Yeah, hi, my name is Dr. Bruce Crispin, and I'm the owner of Aesthetic Professionals Dental Education Center. I'm a fixed prosthodontist, and one of my missions in life is to teach dentists how to do advanced fixed prosthodontics, but teach it in such a way where it's not so complicated. And I think if you've ever thought about taking our advanced fixed prosthodontics mentorship, you might say, well, I never see these big cases, I don't want to do big cases, they're too complicated, they're too expensive, whatever. And I think one of the things we teach in this program is really how you can break it down into very simple steps so you can understand it, less intimidating. And quite frankly, I think any dentist that's willing to learn the basic steps can do it. But also it teaches you how to segment cases. And so what I thought I'd do in the next few minutes is just show you 4 cases that were done last year by the residents in our fixed prosthodontics mentorship to give you some idea of what we do. Okay, what I'd like to show you now are just a few cases that were done by our residents last year. Okay, so they were all done by dentists that had never done a case this complicated before, and I want you to kind of see what was done. Okay, I want you to note that all the photography was done by the residents. This is not a photography program, so you know the level of photography is a little bit amateurish at times, but I think I want you to look at the big picture and kind of absorb, you know, kind of what they accomplished and not be too critical of their photographic skills, because these were all done, remember, in a clinical environment where they were working hard, and you know, photography was maybe not, you know, they weren't planning on presenting these at a big meeting or anything, so we were basically taking photographs for documentation. So let's take a look at case 1. You can see case 1, here's the pre-ops. We've got some significant discoloration, malpositioned teeth, got lots of restorations. The lower incisors were terminal and needed to be extracted. And so you can see a lower bridge was done, and they completely rehabilitated this patient's mouth with some really nice restorations. These were a combination of veneers, fixed partial dentures, and crowns, and a combination of materials. Some of it was zirconia, some of it was Emax. And so in this program we learn about how to apply the different materials as needed. Here you can see the lateral views of the preoperative situation. So a pretty typical case that's had dentistry done over many, many years, but the deterioration has really been unchecked for all practical purposes, and the patient was ready to get their mouth rehabilitated. And here you can see the lateral views of this case. And we didn't do the second molar, it was intact. I mean, the first molar on the left, it was intact, didn't really need to do it. But I think a pretty reasonable job. Here's another case. This was pretty severe worn dentition, and this was a fairly young individual. This is what he looked like preoperatively. And I think you look at these cases, and you know, the first question you got to ask yourself, I've got a young individual who's destroyed their teeth, you know, how am I going to prevent this? And these are the things we work on and discuss in this class. This patient needed a little preoperative periodontal surgery in that anterior cent where the teeth had hypererupted, so we went ahead and did that. This is kind of the sequence of fabrication. We fabricated the entire maxillary, the lower anteriors, tried that in before we finished the lower anteriors, and this is how we minimize the amount of occlusal adjustment. These are all done in monolithic zirconia, and you can see we got multi-layer, which is a nice transition. This was at the try-in appointment. You can see there's still a little bit of tissue irritation on the lower right there, but for all practical purposes, the tissues look pretty good, considering that this patient had been in provisionals for quite a long period of time. Here you can see some occlusal views of the severe wear, and here you can see the lateral view. So really a pretty amazing result. Preoperative smile, postoperative smile. And again, these are all monolithic zirconia, so they're extremely strong and, you know, fairly aesthetic, pretty aesthetic. So here's how he looked to begin with. Didn't really want to smile, didn't like his teeth, didn't like really anything about his teeth. And then after we were finished, it's amazing how their face seems to be more relaxed. They smile. They're not inhibited. So it's the sense of accomplishment you get out of doing cases like this is pretty phenomenal. This was a woman that wanted to have white teeth. She had quite a bit of wear. We don't dictate color. And so we made her some really nice white teeth. So you can see the before and the after full face. She had a lot of wear again on her front teeth, some problems with number 9 there. I forget exactly what happened there, but it wasn't in very good shape. Abfraction, a lot of wear, loss of anterior guidance. Very typical dentistry that you see in your offices every day. And so to fix this case, she needed to have a vertical dimension change. She needed her anterior guidance done. And she wanted her teeth white. So we went ahead and, on her dictates, made them pretty white, as you can see. So we don't dictate color. Here's her smile before. Here's her smile after. And our final case that I'm going to show you for the sake of brevity, and we do many cases every year. You can see another severe wear case. This is a fairly young individual. He's a contractor, painter. And here's post-op case. And again, this is all made out of monolithic and some layered zirconium in more aesthetic areas. Here's a close-up of what he looked like initially. Significant wear, significant abfraction. This is what he looked like post-operatively at the delivery appointment, final delivery appointment. And here's before. And you can see here's the after. And you talk about making an impact in somebody's life. Also, I want you to notice his masseter muscles. We also did some occlusal therapy, some relaxation therapy. Notice how it looks like he's lost weight. And so really a lot of it is just the deterioration in the size of his masseters. You can see how big they are here and how they've kind of shrunk back, from just giving a good solid centric occlusion, giving him good anterior guidance. We could get his muscles relaxed. His symptoms went away for the most part. And obviously we got a happy camper. Now the story really doesn't end here. We do post-op splints and post-op T-scan to check the occlusion, but this is just a quick overview of what can be accomplished in this course. All of these cases were done by residents in our Advanced Fixed Mentorship Program at Aesthetic Professionals Dental Education Center. Every one was the first full mouth reconstruction that these dental teams had done. We usually have the doctors work in teams. And while the photography is a little consistent, the dental outcomes were life-changing for these patients. Any dentist that is willing to learn can do this. My question is, are you ready to start? Thank you.